Today, I'm going to be talking about research that shows that people that are diagnosed with multiple sclerosis and are taking disease-modifying drugs, how they're finding that those people have much higher incidence of infections and even serious infections that cause them to be hospitalized. My name is Pam Bartha, and it's a real privilege to share this information with you because I was diagnosed with multiple sclerosis over 30 years ago. And back then, I decided to take a different approach, a different way to treat the MS by treating the cause. If we haven't met yet, I've got a lot of videos that talk about how that I believe, and a lot of research is showing that multiple sclerosis is an infectious disease. It's caused by infection. So this study, this research that I'm going to talk about today is really important because it helps us to explain why when we take the MS drugs, why we are so much more at risk of having other infections. And some of them are actually really serious where we can end up in the hospital. And it's much more than that. These drugs, because of how they work in our body, they are actually causing us to suffer with our disease, but also pick up other diseases. And we'll talk about the whole mechanism of how that works. So there is this group in the United States, and it is called the America's Committee for Treatment and Research in Multiple Sclerosis. So actrems is short. ACTRIMS. And at their event, their live event just this year, 2021, they highlighted new scientific research and discoveries that were made in the field of multiple sclerosis. So that sounds really exciting. So let's talk about some of the agenda topics they talked about. They were talking about MS in children. They were looking at aging and rejuvenation of the cells, the nerve cells that make myelin. They were looking at the effects of aging in multiple sclerosis, menopause, and hormonal effects, the reality of MS epidemiology in Latin America, different populations in Latin America, relationship between obesity and MS, metabolic immunological interaction, spectrums of MS demographics in, again, the Latin community, MS and intestinal microbiota in the Latin community or population, COVID-19 and MS registry information, and vaccine responses. So this is a very important coming together of scientific minds and different groups that are really trying to help us to resolve this whole MS issue. And the problem is that with multiple sclerosis, I was diagnosed over 30 years ago, and today we still don't know what causes MS, and there still is no cure. So if you listened to that list of all the topics they were talking about, did it really sound like there was a lot in that conference talking about the possible cause of MS, that they're getting closer to figuring out what's causing this horrific disease? You guys type it in the question box if you picked up one topic. There's one topic that might have a slight indication that they're kind of moving towards looking at causes of MS. And that would be the topic where they were looking at the microbiome in multiple sclerosis. Really sad that 30 years later, we're still scooting around the topic. We're just looking at all kinds of aspects of MS, like how does MS affect aging and different conditions with MS and hormones and, MS in kids. But what is causing MS? That should be center and focus of all of these research endeavors. Don't you agree? Don't you think it's time that we found a cure? I think it's time. Myself living with my diagnosis was over 30 years ago, and I've been MS free because I treated the cause. But in the standard of care, they don't believe they know what the cause is. And so this has been well over 30 years in my experience. And I think it's time. I think it's time that we, the people that have been diagnosed with MS, that suffer with this horrible disease, that we start to demand that they start to really go towards finding the cause. And we can do that through our money. that we donate, right? We donate to places where they're looking for different types of infections that are causing MS. We work with practitioners that are interested in, what types of infections could be making us weaker, making us more sick, etc. And so with this topic today, we're talking about how the standard treatments for MS, the disease modifying therapies, how they're causing patients, MS patients, to have a much higher incidence of other infections. So MS is bad enough as it is, but we do not want to have other viral and bacterial infections that can cause us to go to the hospital, whether we have to stay because it's significant or whether we're just outpatient treatment. But this is the case. And when we look at this research, I'm going to talk more about it. So some of the important information that they shared is that they're finding that the infections are much more common in MS patients that are receiving the disease-modifying drugs. And so they looked at a retrospective study of about 15,000 patients in the United States, and that's what they concluded. They found infection rates are higher in MS patients in general, and especially a great concern in MS patients receiving disease-modifying therapies. So all the treatments that are supposed to help us are causing us to have other infections. And the reason why this is true is that, and we're going to look at just some of the common disease-modifying drugs, but the disease-modifying drugs used in MS, they all modify, I call it suppress, parts of our immune system. So our immune system is really our natural defense against infections. And so these drugs are targeting divisions of our military, our soldiers, and suppressing them and preventing them from going into our central nervous system, even coming out of the places where they are made, like the lymph nodes. So this study that they looked at, the 15,000 retrospective study, means that they're looking back. And this was between the years 2006 and 2018. Those are years where they looked at patients that were included. And these patients received disease-modifying drugs, were compared with patients who never received this type of therapy. So you may find this hard to believe if you're using disease-modifying therapies, but there are a lot of people that have MS that refuse these therapies because if they've tried them, they feel worse on them. They feel better when they're not using them. Or some of them are just really concerned about the adverse effects of these disease-modifying therapies. They've researched this. They've gone online. They've looked at all kinds of websites. Sometimes it's the manufacturer of the disease-modifying drug. Or maybe they've looked at PDR.net, Physician's Desk Reference.net, really looking at the mode of action, how this specific drug that they're looking at, how it works in the body, what the adverse effects are. And many of them say, no, that's just too dangerous. I do not. MS is bad enough. I don't want to have a high risk of cancer, etc. So that is your job. That is your job. It's very important before you take any medication to research this yourself. And it's very easy to do. And sometimes we can find, let's say we're dealing with pain or can't sleep, those type of treatments, we can often find something that is not going to have terrible adverse effects. So we want to find something that will help to manage a symptom, and we want to have a lot more benefit and as little risk as possible. So they measured the presence of serious infections, which were defined as the prescribing of medication during hospitalization. So if people were hospitalized because of an infection and they were also given some medications for that, or some other groups were non-serious, so maybe they were outpatient, so they did receive a prescription, but they did not have to stay in the hospital. So these were MS patients that were hospitalized or outpatient that had infections. And some of them they just compared people that were taking the MS disease-modifying drugs compared to people that were not taking them. And they also, this study group, they looked very comparable age and gender and ethnicity and race, and also geographic location. So they try to cover as many different variables to try to make the data as accurate as possible. And the overall risk of infection was higher in patients receiving the disease modifying drugs than those that did not. And it was also greater among people that were older, over 61 years old. And that makes sense too, because the older we are, the more out of balance we are with different microbes. The treatment with disease modifying therapy was associated with higher risk of serious viral infections that required hospitalization, as well as antiviral prescriptions in the outpatient setting. The risk for bacterial infections requiring outpatient antibiotic prescriptions was higher in patients that were on disease-modifying drugs, so on the MS drugs. In addition, having a comorbidity, so if somebody had MS in the study, but they also had something like diabetes or chronic obstructive pulmonary disease, maybe they smoked, or they had some other type of autoimmune condition, that increased their risk of infection when they were taking the disease-modifying drugs. And all of this makes sense when we know that MS is an infectious disease. It's caused by a state of dysbiosis where we're really out of balance. We have too many bad or disease-causing microbes and not enough health-promoting microbes. Then all of these things make sense, because these other conditions or autoimmune diseases just mean we've got other microbes that like to live in other parts of the body, causing other symptoms, and then we get a different disease label. So they said our study had a large proportion of patients that were using different types of injectable MS drugs, and they're finding that MS patients receiving disease-modifying drugs would benefit from being followed by their doctors. What they're saying is that with this knowledge that people that have multiple sclerosis that are taking the MS drugs, because they will have a higher incidence of infections, they should be monitored by their practitioners, by their neurologist, for infections. And also, again, if they have other comorbidities like diabetes or other autoimmune diseases, that they really should be monitored by their neurologist for infections. So we know that MS is an infectious disease through tons of research. If this is new to you, then go to our website, livediseasefree.com, livediseasefree.com. Under research, I have separated just a few studies on MS and fungal infections, MS and bacterial infections, MS and different types of parasites like worms, etc. So there's lots of evidence that when we have multiple sclerosis, when we suffer from it, that they are able to find fungus growing in the central nervous system, inside our brain cells, inside the nucleus of our brain cells. They're also finding that there are small worms, filarial worms, in the central nervous system, and those worms cause problems themselves, a lot of damage, but they also carry Borrelia, which is the bacteria that causes Lyme disease. So they infect us with Lyme disease. And we know that the central nervous system is not a sterile environment. We know that all kinds of microbes can get through the blood-brain barrier, and that is why we need our soldiers in the central nervous system. We need our T cells, we need our B cells, we need our immune system to protect us from infections, not just in our body, but ones that would make it into the central nervous system. The disease-modifying drugs, so I'll just talk about a few common ones. So we know that all the MS disease-modifying drugs, they all suppress parts of our immune system. So they are dampening or they're impairing the efforts of our natural defense that protects us from infections. So, for example, Gilenya is a disease-modifying drug that traps the lymphocytes in the lymph nodes. So they prevent them from leaving the lymph nodes. So those are like a type of soldier that defends us from specific infections. So when we take Gilenya, eventually our lymphocytes become dangerously low, and then they switch us to a different drug. Tysabri, if you go on their website, I don't see as strong, but in the years past, I would see a huge banner at the top and at the bottom of their website about how it can cause this horrible, terrible, rare brain infection, PML. This brain infection can kill us. There is no cure for it. And, MS is bad enough. So the problem is that they're only testing for that and they're not testing for other infections. That's a really big problem. So Tysabri will inhibit our lymphocytes from entering the central nervous system. So it actually decreases the B cells and the T cells from entering our central nervous system. So that makes us vulnerable in our central nervous system for other infections. Same thing with Lemtrada. Lemtrada is another disease-modifying drug that also decreases the T cells, the B cells, and the monocytes or macrophages in the central nervous system. Tecfidera, which is another disease-modifying drug, that is something that dimethyl fumarate is the active ingredient, and that active ingredient has antifungal properties, and it's been used in industry to prevent mold from growing on leather, furniture, and shoes. And it is so toxic that they have banned it in the European Union, and there were lawsuits because people are getting such horrible rashes from this dimethyl fumarate. And guess what we're doing? We're giving it to MS patients internally. Yes, we are. So that would be Tecfidera. Again, it decreases our B cells and our T cells that are in the central nervous system. So it decreases our defense in the central nervous system. Then I think and then Ocrevus. I wanted to talk about Ocrevus because that is really, really popular right now. So Ocrevus is a type of chemotherapy drug, and it destroys our B cells. And the adverse effect or risk is cancer. So what's worse, MS or cancer? All of these drugs are attempting to, let me backtrack. MS there's always a lot of inflammation present in multiple sclerosis, but in all chronic disease. And the inflammation is really the war zone. It's where our immune system is fighting infection. And so instead of treating the infection, they've decided, well, let's just suppress the war. Let's just suppress the immune cells. And that way, hopefully, there's less symptoms and people can just take it forever. And then, we have this huge industry. The newer drugs are over $100,000 a year is the profits on that. And our neurologists are getting kickbacks on that also, getting paid very well to prescribe. So what happens is that we are taking something that is suppressing our T cells, our B cells, our monocytes, macrophages, and that is making us weaker. So as we are weaker, then other infections can move in, and they like to live in different parts of our body. Some like to live in our joints, in our reproductive, in our organs, in our blood, in our intestines, on and on. So whatever different types of infections or parasites we are exposed to, and our defense is compromised, our soldiers are not fighting like they should, then these bad microbes other ones can move in, establish themselves. We end up with other symptoms, and then all of a sudden we have another disease. And then we have to take different immunosuppressive drugs to try to deal with those symptoms. So we're trying to suppress the symptoms of inflammation. Meanwhile, these critters, these different types of infections become more and more populated. We become more and more disabled. We have more and more symptoms. We have to use more and more medications. We get different types of infections, as this research group is finding out. It's like, duh, that's a no-brainer. If you are taking immunosuppressive drugs, you are going to have more infections. Is that acceptable this late into the game? Like, is that acceptable? Are we going to put up with that? Is that what we want? No, that's not what we want. MS is brutal. People suffer terribly, as is Parkinson's and ALS and MS. And it's time we start to hold people accountable. It's time that we start to say, Enough is enough. We want to figure out which infections are causing the problem. We want to focus our attention on treating infections, correcting our microbiome, allowing our system, our immune system we need it. How foolish, how ignorant have we become that we think we don't need these T cells and B cells? It's ludicrous in my mind. It really is. Sorry, I'm ranting, but it drives me crazy that it's so hard to get things to change. Our system is so stuck because there is so much money involved, unfortunately. And I'm not blaming our neurologists. I'm not, because they are doing the best they can with their training. But there are people at the top that know, and they've made a decision that it is not profitable to treat parasites. It's not profitable at all, so we don't treat infections, which are the parasites. Any microbe that lives in us and causes us harm is a parasite. That's fungus, that's bacteria, single cell parasites, and multicellular parasites like worms, fungi, etc. All of them are disease causing. And so if you follow my work, you understand that when we have a serious disease label, then we're really out of balance. We've got multiple bad microbes we need to address. And as we treat them and we knock them back, we get our life back. We don't have to live on these immunosuppressive drugs. We don't have to worry about more and more infections. What I see really traditionally with the MS community is that the bladder becomes infected, and we start with urgency and we're getting up through the night. And then we start to get urinary tract infections regularly, and we're put on more and more antibiotics, which makes all these infections worse. And it's a spiral downhill. And that's why some people choose not to use the disease-modifying drugs, because they feel better when they're not on them. So I'm going to go to your questions, and then we're going to talk about solutions of what can we do so that we don't have to rely on treatments that will increase our risk of infection. Hi, Maureen. Hi, Lisa. Good to see you. Hi, Larry. You have MS right now and you're dealing with this, but you want, but I know that MS, with this, but I know that the MS, I wish they could find a cure for MS. Yes, I agree. I hope it could be time for it. I'm sorry, I'm not sure what you mean. What I assume that you mean is that you're dealing with multiple sclerosis and you're really hoping that they're going to find a cure. Well, I'm going to be really honest with you, Larry, is that if you hold your breath waiting for a cure, you'll probably pass out, because we are not looking for a cure. They are looking for different types of therapies to manage the MS, and they're not looking for a cure, because if our healthcare system treated infections, it might cost, let's say, $5,000 or $10,000 with doing some tests and multiple treatment cycles, etc. And then you're done. No more patient, no more customer. But if you are continuing on disease-modifying drugs for the rest of your life, some of these newer drugs are over $100,000 a year. That's what they're being billed at for as many years as your body will handle them. That is why we are treating MS the way that we're treating MS. Hi, Joe. You agree? Yes. Hi, Alicia. Hello. Hi, Marianne. Hi, everybody. Trisha, does anybody have any information on why some of the disease-modifying drugs help MS symptoms to be reduced? So you believe what I'm saying is true. However, you have a couple of friends that are quite close that have taken the disease-modifying drugs and feel so much better on them. You're wondering why this is. Again, if there is any benefit, it has to do with that if your immune system is fighting really hard against the different infections, and then you shut down your immune system, you don't have the war as strong, correct? And really our symptoms are they're not directly caused by these parasites, but it's the war that our immune system is fighting those parasites. So if you stop the war, you might feel a little better for a while. But if you stop, but the problem is those parasites are taking over more and more territory in our body more quickly because the immune system is not holding them back as much. And so people still become disabled. What I have found is, like, let's say, for example, with Copaxone. Copaxone's been around for over 20 years, and so has Rebif. So those are some of the older drugs. And when they were first announced and released, it was like, wow, the clinical trials show that there's at least a 30% decrease in MS attacks using them. And now, over 20 years later, they've looked at all the well-done studies. This is the Cochrane Library. And they have found that there is no difference in people that were taking those drugs versus the ones that were not taking them. And this is to do with the time to disability, the progression to disability. And that makes sense because they're not treating the infection. So it made no difference if you were taking the drug or not as to how much time it took you to become disabled. I know that people that are taking these drugs, very often they start to make lifestyle changes. That could be why they're starting to feel better. A lot of people that have MS, they do have 5 or 10 good years, whether they use these drugs or not, where maybe they've had an attack or two and things settle down. And this usually has to do with something in the environment. So maybe when they had the attack, they had like higher stress, maybe they weren't sleeping as well. Very often it's like this stress of like relationship, broken relationship, or maybe somebody you love is very sick, but something really gut-wrenching emotional that really sets off an MS attack. And it could be sleep deprivation for a long time. It could be eating the wrong foods, a lot of the wrong foods in combination with some of those other things. So those would be reasons why we might have an MS attack. And so very often when people get MS, then they're like, okay, what can I do? What can I do? I'll go on the drugs, but what else can I do? So they might clean up their diet quite a bit. And that they might do enough things in their life so that they start to feel a little better. And it might not even be the drug, because the drug is not treating the infections. And then what I have seen is that some people get 3 years, some people get 5 years, some people have 10 years of where the disease is really not that active, and it has a lot to do with where your immune system is at. But then there comes a change again with more stress of some type. And then we start to see, especially as we get older, that there is a more consistent, quicker decline in our health, in a quicker decline or increase, I should say, in the disability. So that's what it is. And then it changes from relapsing remitting to progressive, where relapsing remitting, we get the breaks. Our immune system is able to kind of deal with it well enough so that we're almost symptom free, or we've kind of gone back to how we were before the attack. And then as we have these infections and they become more populated and we age, then we don't get the breaks anymore. And then we have more of a constant, a continual decline to disability. And that is then called progressive, where you do not have the break. So again, it's not really different types of MS in my view, in our experience, and it makes sense why over 80% of relapsing remitting will turn into progressive. So that's a really great question, Tricia, but that's really what it has, that is really what it's all about. All right, so Marianne, you tried 3 MS drugs, A, B, C, while able to walk. Within 9 months, you were so much worse. In fact, you were in a wheelchair ever since then. And I'm so sorry. I am so sorry to hear that. And I do hear that a lot. Really awful. And I'm sorry. Again, there is, in my view, in my personal humble opinion, and I'm not against pharmaceuticals at all. I mean, LDN is something that is not going to be as toxic. Some people get it worse on it. Some people it helps a little. A lot of people it does nothing for. But that would be one of the safer disease modifying drugs. But again, they all have an LD50 rating. They all have a lethal dose 50. That means that at a certain dose, 50% of the rats were killed. And they're all impacting our immune system. We need our immune system. Our immune system is not the enemy. As the wellness champions treat these infections, they recover. We've got lots of successes on our website and on Live Disease Free YouTube page or channel. Make sure to watch those. So, hi, does the autoimmune protocol work for multiple sclerosis? I don't know. There are so many different plans and protocols, etc., out there. I don't know which one you're talking about, but the one that will work is the Live Disease Free System plan. What we do is, number one, the diet. The Live Disease Free diet is decrease the food to those parasites that are giving you the symptoms. They all love carbohydrates. So as you decrease the carbs, you will find that you will have symptom relief because the inflammation goes down because they're not as active, and you'll have significant symptom relief, especially with bladder issues and others. Secondly, support the body. Third is treat the infections. I don't like the word autoimmune. I know that's how we explain things, but it is not our immune system just recklessly attacking our tissue, our cells. It is that there is an unfair fight. There is immune dysfunction because of these infections. There's like an overwhelm of it. It's like a really bad war that's gone totally haywire. That's what it is. And as you decrease the parasites, the immune system is able to help more. And of course, we support it using a holistic approach. And that is the Live Disease Free System. And that is when people recover and they don't need the disease modifying drugs. And they no longer have the bladder issues. They no longer have viral issues. They no longer have any types of infections. Is that they're correcting the microbes that live in their body, increasing the health promoting microbes, decreasing the disease causing microbes to the point that they're symptom free. Candace, that's a really good question about the shot for MS. Any thoughts? I have a lot of thoughts on that, but I can't talk here. If you email us at info@livediseasefree.com, we will send you what we think. I can't here because the censorship is out of control, but just go to email info@livediseasefree. Lots of serious thoughts about that. All right. So Amy says, huge, never for me. Yay, that I'm assuming that means that you are not going to go with the different disease modifying drugs. Joanne said, I've had a blood infection 4 days in the hospital. I'm really sorry to hear that. And you will notice that you will continue to have more and more infections until you take a different approach, until you take a different path. And the Live Disease Free plan system is the path that helps to correct all these or treat these infections that you're dealing with, especially the ones that are causing MS, so that you no longer have them. So you may be wondering, like, how do I figure out what infections I have? How do I treat them? That's what we do in the Live Disease Free Academy. So if we haven't met before, if this is the first time you found me, make sure to watch my videos on Live Disease Free YouTube channel. We have a playlist of different types of infections. You get to see worm pictures of what our students have been passing and pictures of all kinds of different types of infections that typically MS patients are dealing with. Start to change your diet. Follow the Live Disease Free diet. You'll find videos that explain how to do that there. You will also find a cheat sheet on the Live Disease Free community in Facebook. And so you can print that off and you can put it on your fridge, and then that'll really help you to make sure you're eating the right foods. And then also just go through the different videos. There are a ton that really help you to understand how infections are causing all these symptoms. You'll learn a lot. It'll really make you clear on what's causing the disease and what you need to do to recover. And then if you need help building a plan to treat these awful parasites, we'd love to help you in the Live Disease Free Academy. Just simply watch my masterclass training, how myself and other wellness champions have recovered from MS. And after you watch that, if you'd like to join us in the Academy, then just click on the link and you'll be able to fill out a form. and you'll be able to pick a time to chat with me about getting started. And before we chat, I'm going to send you the Coachathon, which explains the Academy in detail so that when you and I chat, you'll have much better questions from me. You'll know exactly the cost, what's involved, what you're going to need to do, and then you can just ask more specific questions. A lot of students just listen to the Coachathon and then they just join right after that, but I still would like to meet you. I'd like to know a little bit about your health history, what you've done before we work together. And then you can be a wellness champion and I can brag about you also. So with that, I'm going to let you guys go. If you find these trainings that I'm sharing with you, if you find them helpful and you would really like to help us to get the word out, you'd like to help us to get different conversations around MS where we're talking about the cause, we're talking about these infections, please like and share this video with others. And then if you'd like to know when I am going to be going live, if you subscribe to Live Disease Free YouTube channel, you'll be notified every time that I go live, and you can join in on the trainings and you can ask real-time questions. So with that, I'm going to let you go. Take care and bye-bye for now.